Hi guys, my name is Jen Slade and this is Go Cup Yourself episode number 2. So if you tuned into my first video, I was speaking about how you may want to consider adopting a cupping practice at home for your self-care. And this information is also really important or relevant for anybody who's interested in just working with a cupping therapist or a massage therapist who practices cupping as part of their body work or self-care routine as well. So today I want to talk about safety and contraindications because I think it's really important to talk about these things before we dive deeper into how to actually do the damn thing and how to address certain issues and concerns, where to buy cups, what I suggest to start with. All of that information I believe comes second to just understanding who this is for and who it's not. So I do have some notes, so if you see me looking over at any point, just kind of making sure I'm keeping myself on track. So let's dive in. So to get started, I want to talk about this idea that cupping is a detoxifying process. So negative pressure helps to pull substances, molecules that are stuck in the tissue up towards the surface where they can be cleared by the blood and the lymph. And this is why we see marking with cupping. It's not a hickey, or it's similar to a hickey, but it's not a bruise. It's anything that's been stuck in the tissue that gets rapidly diffused up to the surface. I know cut marks are often mistaken as bruises, but they are not. They clear the same way as a bruise, which is why it'll look like a bruise and fade out similarly, but it is not the same thing. So due to this detoxifying effect, we have to be aware of overloading the system. And so a lot of what you're going to hear me talk about over the next little bit here in this episode is our conditions in which we would not want to overload the body. All right, so going from there, first to start off, I want to talk about blood thinners. So if you are on a prescription blood thinner, which many Americans are, at least I know for this country, there are likely a few key reasons why a doctor would place their patient on a blood thinner. And we're looking at clotting disorders or conditions such as heart attack or risk of heart attack or stroke or risk of stroke. So if you have any of those qualifications and find yourself on blood thinners, this is something that we're going to have to be aware of in your cupping session. Cupping impacts blood flow. And so if you are at a higher risk for clotting, cupping can potentially put you at a higher risk for moving clots through the tissue, which is something that we don't want to do. In addition, if you're on blood thinners, it also does mean that you could mark up a lot darker as the blood can come up to the surface a lot faster. Not always a bad thing per se, but again, just coming back to not overloading the system and doing as little as possible to help bring the greatest possible benefit to the client. So going from there, if you are on a baby aspirin, like a maintenance medication, I do feel that that's okay to still receive cupping. However, I would, for myself, for anybody who comes into my practice who writes baby aspirin on their intake form under the medication line, I know to take it a little bit easier with the cupping, especially at first until I know that client and know how their body's going to respond to that therapy. All right, so going on from there, the next thing I want to talk about are liver and kidney disorders. So if you have a liver or kidney disorder, cupping is going to be something that you want to be really careful with for that toxic load reason. So as we know, the liver and the kidneys are major detoxifying organs in the human body. So when we are cupping and all of these things are getting released into the bloodstream, metabolic waste, cellular byproducts, potential pharmaceutical residues, environmental residues or toxins, all of these things are flooding the system, and then they're all going to go to be processed by the liver and the kidneys to leave the body. And so if we are cupping and we send a mass amount of these toxins essentially to the detoxifiers, and the detoxifiers are already vulnerable, then we risk overloading the system. So super important to note there. And for that reason, that's also a reason why we want to drink a lot of extra water after body work in general or cupping, because things are released even just through massage. And so you want to just make sure that you can help support the body in clearing anything that gets released throughout the rest of your day and the next day afterwards. All right, so moving on from there, we're going to go to pregnancy. So if you're pregnant, it's probably not the best time to start a cupping practice. It's okay if you have had cupping done before, you know how your body handles it, you feel comfortable with it, and then you're pregnant and you want to still do some cupping through your session. As long as your therapist knows what they're doing and knows what areas to avoid, then I think that's totally fine. I do cup some pregnant clients. Probably not the best time to begin a home practice, however, just because you want to be extra careful. And again, going back to that toxic load, you don't want to overwhelm the system. So going on from there, cancer treatments and radiation. Chemotherapy drugs can be cleared through the system the same way other pharmaceutical residues can come up to the surface during a cupping session. So again, coming back to overloading the system, if you are in cancer treatment, you're likely a little vulnerable to begin with. So cupping is probably not going to be the best thing for you to experiment with at this time. In addition to that, radiation can leave the tissue very brittle or fragile or frail, even up to years after radiation treatments. So that's also something to be aware of. You could potentially risk doing more harm than good. Other than that, fresh bruises. Bruising is essentially blood clotting beneath the surface of the skin. So we don't want to do any cupping directly over fresh bruises. However, once that bruise is a few days to a week old, depending on the intensity or severity of the initial injury, then it would actually be beneficial to do cupping because it will help to move the lymph from the tissue. Also, recent sprains, strains, or breaks. We don't want to cup directly over fresh injury. However, once it's begun the healing process, maybe after about 3 to 6 weeks, depending on the intensity of the injury, cupping can actually be really beneficial to help break down any scar tissue or adhesions that have formed in the tissue, and also just to help clear any extra lymph that's hung around in the form of inflammation. So those are the key things to be aware of to avoid. I also suggest considering not cupping if you're on any kind of pharmaceutical pain medication, as it can alter your ability to sense the intensity of the cup, and you don't want to risk hurting yourself or overdoing it. For similar reasons, I suggest not having cupping done or cupping yourself while you have taken a muscle relaxant. So moving on from there, I want to touch a little bit on what areas not to cup. This is a question I get a lot from clients, and so I just want to take a minute to touch on that as well. Especially as you start to adapt to cupping home practice, it's really important to know that there are some areas that you've got to be really careful over. And these areas are mostly all the very yin areas of the body, or areas where there is a lot of vasculature that's very close to the surface. So we're talking about anterior neck, especially the left side where we have the carotid artery that runs through. The axillary region underneath the armpits, we don't want to cup through there. You don't want to cup over any large protruding veins. So if you have like a large vein on your hand or on your arm, tops of your feet, anywhere where it really sticks out a lot, you want to not cup right over that because that vein's very close to the surface. Also the inguinal area in front of the hips where the femoral artery runs through, the popliteal artery right behind the knees, so no cupping right behind the back of the knees. And other than that, those are the key spots that you really just want to avoid. So beyond that, you're pretty good to cup other areas, but of course, with intention, with knowledge, not just throwing cups anywhere and hoping for the best. So on that topic, stay tuned for more information down the road on how to address certain issues, common pain points, and just how to approach this whole process of self-cupping in general. So if you found this helpful, please share it, save it, tag somebody who needs to see it, and tune back in for future episodes where we talk more about the nitty and gritty of how to go cup yourself at home. Thanks for tuning in.